So today we are going to do the clinical examination of precordium. Precordium is an area which overlies the heart. It's the part of the chest that overlies the heart. So first of all, what we need to do is introduce ourselves and take the consent from the patient. मेरा नाम डॉक्टर आदिल है, मैं आपके दिल का मुआयना करूँगा और इस दौरान मुझे आपकी जो है वो छाती से शर्ट उतारनी पड़ेगी, तो आपको कोई किसी जिस्म के हिस्से में तकलीफ तो नहीं ठीक है। और अगर आपको कोई मुआयने के दौरान तकलीफ हो तो आप मुझे रोक भी सकते हैं, ठीक है। आप अपनी जो है शर्ट रिमूव कर दें। सो while patient is removing the shirt, it should be above the waist. The exposure should be above the waist. And in case of a female, if you are examining a female, you need to have a chaperone with you. Okay. So basically what we do is that please remove इस एग्जामिनेशन के 4 पार्ट्स हैं। फर्स्ट ऑफ ऑल इंस्पेक्शन, देन पैल्पेशन एंड देन परकशन एंड ऑस्कल्टेशन। कोई भी आप एग्जामिनेशन करते हैं उसके यही 4 पार्ट्स होंगे, ठीक है। ये उतार दें प्लीज। तो इंस्पेक्शन, पैल्पेशन, परकशन एंड ऑस्कल्टेशन, ये 4 पार्ट्स होते हैं। अब आप प्लीज देखें। So first of all, always approach the patient from the right side. आपने हमेशा पेशेंट को राइट साइड से अप्रोच करना है एंड लुक फॉर द चेस्ट। In a normal patient, it is symmetrical, bilaterally symmetrical. Check for for any scar marks in the center or any pacemaker, and also check for any visible veins. Normally veins are not visible in a normal healthy individual, and after that you should check for the pulsation that is visible in this part of the chest. Outer and most lower is the pulsation that is felt, which is called the apex beat. Usually it is 9 centimeter from the midline, and it is 1 centimeter internal to the mid clavicular line in the 5th intercostal space. And how we can locate it, I will tell you in the palpation. So after that, inspect in the neck area, anterior triangle of the neck on the right side, and check for the same for the left side. What you need to remember is don't touch the patient while you are doing the inspection. After you are done with your inspection, the next thing that you are going to do is the palpation. For palpation, what you need to do is you should take your hand like this and place it like this. This part of the hand, you should feel the visible pulse. Okay. So usually, what I told you is this is first of all locate the sternal angle. It is the 2nd intercostal space, and from that 3rd, 4th, and 5th. So in the 5th intercostal space, 9 centimeter from the midline and 1 centimeter from the mid clavicular line, the apex beat is palpated. Okay. So after doing the apex beat palpation, you look for the thrill. I would suggest that you should check all the areas. This is the area of aortic valve, which is to the right side of the sternum. This is the pulmonary area, tricuspid area, and mitral area. You should check all the areas for any thrill. Okay. So what I have remembered from a mnemonic: all people read Time magazine. So these are the 4 areas that you should focus on. And after that, you should check for the right parasternal heave. इसमें क्या होगा कि आपको यहाँ पे अपना हाथ ऊपर जाता हुआ फील होगा अगर राइट पैरास्टर्नल हीव होगी, और राइट पैरास्टर्नल हीव हमेशा लेफ्ट वेंट्रिकुलर हाइपरट्रॉफी को शो करती है, ठीक है। ये आपने देख लिया। सो आपने एपेक्स बीट पर लोकेट कर ली है और आपने अपने थ्रिल के लिए देख लिया, ठीक है। उसके बाद आपने अगला स्टेप करना है परकशन। परकशन के लिए आपने ऐसे करना है कि अपनी मिडल फिंगर ये प्लेक्सीमीटर का काम करेगी. डू इट लाइक दिस. So from the third, fourth, and fifth, you should come down and you should locate the left border of the heart. For the rest of the borders, you cannot discriminate between the borders of the heart because of the anatomy of the heart where it is located. So after doing the percussion, then is the auscultation. It's a very important part. What you should do is check for all the areas. Check for all the areas. Aortic, pulmonary, tricuspid, and mitral. So there are basically 4 heart sounds. The S1, that is lub-dub, that is formed when the mitral and tricuspid valve closes, and then the S2, which is aortic and pulmonary valve closure, S3, which shows the passive filling of ventricle from the atria, and last is S4, which is atrial contraction. You should check all these areas with the help of stethoscope. Obviously, you're doing the auscultation, and after that, you need to look for the murmurs. There are different murmurs, but for the 2 notorious murmurs, one is mitral regurgitation murmur, and one is aortic stenosis. For basically, a murmur is a turbulent flow of the blood. So for the mitral regurgitation murmur, you should check in the axilla also. You should palpate it here and check it from here. It radiates to the axilla. And similarly, for the aortic valve murmur, aortic stenosis murmur, it radiates to the carotids. Okay, so these are the basic steps: the inspection, palpation, percussion, and auscultation. After doing the examination, you should thank the patient and recover the patient. आप प्लीज़ अपने कपड़े दोबारा पहन लें और आपका मुआयने का बहुत शुक्रिया.